But let's assume tomorrow you wake up a billionaire or a millionaire, right? And you have 100 million to improve Africa's healthcare system.
Yeah.
How would you go about doing that?
Well, I always believe that when it comes to health, prevention is better than cure. I mean, most healthcare systems are based on when you're sick, you come into the hospital. And I always think, well, why aren't we tackling why people are before people are sick? So a lot of the diseases that overwhelm a lot of African hospitals, sometimes they're curable. If you look at things, even cancer, like basic cancer diagnosis, screening, stuff like that. So, going back to your point, if I had 100 million, what I would try and do is invest in technologies that bring down um, the the time for diagnosing people, because when people get diagnosed later, that's when it becomes fatal and becomes overwhelming for health systems. So what I would look at is technologies that can look at prevention much earlier on, for example. So that will release the burden on a lot of teachers. Sorry, a lot of doctors being overwhelmed, like in hospitals in Africa. So I'll look at investing definitely in technologies that look at prevention mechanisms, for example. And also, I think looking at maybe some kind of self-diagnosis. And one of the things that I was looking at as well was looking at maybe leveraging technology like maybe drones to get basic medication to difficult, hard to access areas, especially some villages that don't have proper roads. Sometimes someone might travel like 2 days to the hospital and all they needed was like I don't know, Panadol, for example. And they've spent so much time and they've lost a lot of earnings because when they're not working for 2 days, they're losing money.